HIV stands for human immunodeficiency virus, and basically HIV is an illness and it attacks your immune system. So the main ways of catching HIV are through unprotected sex with somebody who has HIV. Other ways that the virus can be passed on are from a woman to her child during childbirth, or things like sharing injecting drug use equipment.
Over the years, I always thought I would never be able to have a baby. That was it. Couldn't even look at babies, and it was horrible. And then as time went on, you know, it was sort of like a 15% chance, and then 7% chance that, you know, the baby would contract it mother to baby, and then it went down to 1%.
Many women assume that if they're pregnant and they find out they're HIV positive, that they'll pass on HIV to their baby. But that's not the case these days. With good treatment, they can not pass on HIV to their baby.
As soon as we were married, we started trying, and yeah, it took about just over a year to actually conceive. I suppose because it's slightly clinical or technical in the way that it has to be done, it may be a bit harder to conceive, but yeah, all worth it in the end.
There are three main ways in which pregnant women can avoid passing on HIV to their babies. So the first is that they can take HIV treatment themselves. The second is that in some cases they may be offered a caesarean section rather than a vaginal delivery, which can help reduce the chance of passing on HIV. And then the third thing is to avoid breastfeeding.
It took me probably the first month to accept that I couldn't breastfeed, and to actually, for her to stop seeking as well, because that was really hard, really difficult. I had to be on the right medication. There's lots of different combination therapy, but you have to be on a specific one that stops the baby from the virus crossing over the placenta, so the baby contracts it. So you have to be on the right medication to stop that. And I also knew about sort of the delivery side of things. They say that they do a caesarean because there was less chance of the baby getting the virus through birth that way. But with the viral load being undetectable, there is a chance of giving vaginal delivery as well. So I just followed all the guidelines because all I wanted was my baby to be born safely and well.
You'll be referred to a specialist HIV doctor who will help not only in terms of your own health and what you need in terms of treatment and good health, but will also help prevent your baby getting HIV.
I had all the scans in the middle of the normal ones that you might have, just to check that the baby was developing normally and everything was going well because of the medication. I just did what I could to be safe. And when I gave birth, they also have to be put on HIV medication as a preventative measure for the first month.
Once you've given birth, then your baby will be tested for HIV, and you should know within a few days whether the baby has HIV or not, and you'll be given a series of follow-up tests just to check that the baby's doing well and is healthy.
The first one was definitely very nerve-wracking, and so I get emotional. And I think we actually cracked open a bottle of champagne and said, you know, that's it, cool, brilliant, because it was really, really good to find out that she didn't have it.
I would just want to reassure women, no matter where they come from and what type of strain of HIV they have, we have very good medications in the UK, and we can treat all pregnant women who have HIV.
Have the test done, because if you can get on the medication, if you were positive, if you can get on the medication straight away, it definitely decreases the risk and hopefully prevent mother to baby transmission. But also I would say to anybody that is thinking or thinks that maybe they can't ever have a life and have a baby and have a normal life, the proof is in the pudding. I'm here, I'm with my husband. You know, I've been positive 17 years. I met my husband 5 years ago, and I've got a lovely home, a lovely husband and a lovely baby. So it's just proof it can be done, and it can be done safely.